Did you know music has a strong potential within healthcare settings? Let's dive a little bit deeper into it. Now, I know a lot of people use music as a form of entertainment, but I guess there's layers to this and that it can be used for so much more. Before I say anything else, I do want to say that I'm not claiming that music is going to be a magical cure to anything, nor am I like a professional or have like the right knowledge to claim anything. I'm simply saying that we should try to use it within healthcare settings, as research does show that there is a potential benefit between patients and healthcare professionals within these fields. And all my sources will be noted in the description or wherever I post this. So now let's talk about the most obvious implementation of music within healthcare settings: music therapy. So music therapy can be described as a treatment that utilizes music in order to help improve mental health, reduce pain, and also reduce stress. The results of music therapy have also just been relatively promising. For example, in a study done, they put women who were experiencing postpartum depression into a 10-week-long program. Within the program, they were tasked to participate in musical activities alongside their newborn kids. And at the end of the program, results showed that women who participated within the program had a reduced amount of symptoms in comparison to women who did not participate in the program. And in another systematic review that overlooked 80 research papers related to people within the spectrum, 30% of the studies reported that they found improvements within the thinking, mood, and social skills. So not only does this show that music is already being used in healthcare settings, but it's also effective at doing its job. However, music isn't strictly bound just to music therapy within healthcare settings, but could also be used in a multitude of ways. In a study done, a songwriting element was introduced into a patient's treatment plan. Within the treatment plan, patients claimed that they were able to see their healthcare workers from a different perspective, and as a result, it allowed patients to feel as if them and their staff are on equal footing, and essentially removed the doctor-patient dynamic within the environment. The introduction of music encourages collaboration and also allows patients and doctors to have a deeper understanding of one another. This also allows patients and doctors to build rapport and trust within each other, and allows for medical staff to have more efficient planning and assessments of patients. So what can we take away from this? I don't know. Although there is a lot of promising results, there are still some factors that we can't just leave out. When pulling out from these sources, most of them tend to measure from short-term effects rather than the long-term. And overall, there just seems to be a lack of standardization across treatments. So that also is a point to just consider when seeing the results of these. Just to counter that point a little bit, just because a therapy lacks standardization doesn't mean that the therapy is flawed. It's just something that could be further looked into to develop more of a, standard treatment. However, with that being said, with the growing popularity and further research of music and the effect on our health, there is no reasons why we shouldn't be using it within our healthcare system. Like I stated earlier, music is already being used in healthcare. So I think right now the best thing we can do is just to further support the research of it and also just shine a light on the capabilities it has been now and what we do know. So the next time you listen to music, just remember that it could do a little bit more for you than you think.